One example of what's come out of that kind of research has been an observation that vaccine strategies, which are very exciting to patients but very difficult to implement because the biology is so complicated, that we found in our laboratories has been that part of the signaling pathways that were not being looked at in terms of the immune system are playing a big role in what happens to the vaccine itself. So we have a clinical trial where we create a vaccine. So we take tumor tissue from the patients, we pull out certain proteins, we create this vaccine that's unique to them, and then we give it back to them as an injection under the skin. So that kind of clinical research is ongoing. But what's been more novel and more recently discovered and published just this year is that there is a signaling pathway, so a protein pathway that is critical for that vaccine actually to work. So this is something that's happening in the cell, not to the immune system itself, that impacts how that vaccine will work. So our next generation of studies will stratify or will take into account whether this pathway is operational or not, because if it is, it may suggest that they'll have a better chance of having a benefit to the vaccine, but if not, wouldn't. And if it's not, now we have drugs that maybe we can use to impact that as well. So we're dissecting all of this together in this systems approach to make what seems like a very wonderful treatment, a vaccine unique to a patient, work better, and if it wouldn't work better, give drugs to make it work better. So that's the kind of iterative back and forth laboratory to patient research that's critical to come up with the next generation, which is always on the horizon. We always have a next generation idea.